Well, for me, unfortunately, my family has experienced a lot of cancer. My mom was in her early 30s and she had ovarian cancer. She ended up having surgery, so she was fine. 30 years later, she had thyroid cancer, and then 2 years later, she had lung cancer. And so she passed at the age of 64. My dad had prostate cancer when he was in his early 50s. So for me, my appointments with my doctors were very important, and mammograms were a part of my life since age 38. It was January the 22nd, 2016, and I sat amongst all the other ladies and went about it, had the visit, left on February the 8th, which was the day before Mardi Gras, and I got a call. They wanted me to go in for a second mammogram and an ultrasound. When the doctor took me back, he said that he saw the need for a biopsy. We had the biopsy, and it was at that time confirmed. It was definitely the carcinoma. When I was diagnosed, telling my family obviously was the first thing that I had to do. We are a very close-knit family. So with that, my question was, what do I do? Where do I go from here? Because I knew that standing still was never an option. Dr. Delatte came highly recommended. I didn't want to do treatment. So we called and made an appointment, and Dr. Delatte got us in that same day. And from the time I walked into his office, I felt like that's where God wanted me.
First met Julie in 2016. She had been diagnosed with ductal carcinoma in situ and was considering having mastectomies and interested in reconstruction.
I opted for the radical mastectomy as opposed to any treatments, just because I felt like it was a better chance for me to not have to go through this again. So then my options were implants versus the D flap.
The DIP flap refers to the use of the lower abdomen as a donor site, where we will borrow tissue, vascularized tissue, without affecting the muscle to the chest, so you can restore the breast with similar tissue, which is the abdominal fat.
It meant that I needed to have enough tissue, fat on my body to take from one area and put in the other.
Thankfully for Julie, as a young and active person, she was in really good shape for surgery in terms of her physical presence.
It would have been easier to do the implants, without a doubt, but it wouldn't have been as good for me. With my family, they were supportive. Whatever I wanted to do was what they wanted for me. We met right before the surgery. They gave me information to guide me along the pre-op. The surgery took 9.5 hours. It was Dr. Kaufman, Dr. Delatte, and then Dr. St. Hilaire. Not only did they take from my legs and from my abdomen, but they had to reconstruct everything for me, because they had to reconstruct the nerves in order for me to have feeling. They sent me home. I think I spent 4 days in the hospital. My recovery was very lengthy. I had to make several trips there. Dr. Delatte, he was always very patient. He always explained everything to me. He was just fantastic. He was awesome. So worth it, so worth it. If I had to do it again today, even knowing the pain that I endured with it, I would do it again today. And I would want Dr. Delatte to do it.